Okay, so now we're going to go over intramuscular injection sites in the dog and cat. So we have our model patient here. So there are three main sites we use for intramuscular injections in our patients. So we have, working from cranial to caudal, we have the neck muscles at the top here, we have the apaxial muscles, and we have the quadriceps muscles just here. So all of these require restraint, so you will want an assistant to restrain the patient while you're giving the injection. The amount of restraint depends on the patient and the muscle body and the volume of drug that you're going to use, and also the drugs. So some drugs such as ketamine are more painful than other drugs. So if we're going to use the neck muscles, we want to kind of go on the dorsal area of the neck. So all of the important structures such as veins, arteries, esophagus, all run along the ventral aspect of the neck. So up at the top here, there's not really any critical structures that we can hit. All we will do is we will take our needle and syringe, palpate the neck to ensure you're in the muscle body, introduce a needle, and then draw back to ensure you're not in a blood vessel, and then slowly inject your drug. Withdraw. For the lumbar musculature, so the landmarks for this are caudal to the last rib, and we have a muscle belly here that you can see quite clearly on some dogs and on also some cats. In cats it's generally more difficult to find. They tend to be a bit slimmer and not have quite as much musculature back here. For this one again, you need pretty good restraint. The dog's head can move around and get you if you're not careful. Again, needle and syringe. So what we want to do is palpate the musculature either side of the spine. I personally tend to keep a finger on the spine to ensure I know where it is at all times, and then aim to one side, introduce my needle in there, draw back to make sure I'm not getting any blood back, and then inject and withdraw. For the hind limb, if we're giving intramuscular injection, we go on the cranial aspect of the hind limb. So we're aiming for the quadriceps muscle, which is located between the stifle and the hip. Generally, it's fairly easy to palpate the quadriceps. It's a smaller muscle belly, so you don't want to be using drugs with a bigger volume. So again, with adequate restraint around the head end, we palpate for our muscle bellies, ensure we're in the right place, introduce our needle, draw back to make sure we're not getting any blood, and then inject. So we tend to avoid the caudal aspect of the hind limb. This is mostly because the sciatic nerve runs through the musculature here. We don't want to inject in or around the sciatic nerve. As you can imagine, that's pretty painful, and you can cause the damage to the sciatic nerve and cause a lameness or pain. So now we're going to discuss sites for intramuscular injection with the live dog. So as before, we're going to work from cranial to caudal. At the cranial end, we have the neck musculature at the front here. So got a nice band of muscle just all the way along the neck, at the dorsal part of the neck. Everything that we want to miss, so jugular vein, carotid artery, windpipe, esophagus, are all at the bottom here. It's got a nice big bit of muscle belly here. So turn, good boy. So you can stretch out the skin and then just inject straight in there. Or if it's a slightly fractious dog, you can grab a handful of scruff and inject into the muscle there as well. So working for the caudal, we have the apaxial muscle group here. So back up, good boy. We have caudal to the last rib and cranial to the pelvis. We have this muscle group. So this is the apaxial muscle group, and you can see it quite nicely on Mac here. A nice big chunk of muscle just in there. Working further caudal still, we have the quadriceps. So we want to go cranial to stifle. So it's just this muscle group here. It's quite a big muscle belly that you can really get your fingers around and go in there. We want to avoid the back area of the hind limb, so the caudal area of the hind limb, just because the sciatic nerve runs down here and we don't want to inject in or around that because that can be very painful for the dog.